Thanks for joining in. You're welcome. I welcome you to this live. Yeah, welcome to my live session. So let's talk about depression. Let's talk about depression. Thank you for joining in. Let's know where you are joining from. Welcome to this live. Thank you for joining in. Who is here? Hello, hello, hello. Have you? Yeah. Hello, Edin Paul. Welcome to my live session. Thank you for joining in. Please let me know where you are joining from. Where is your location, Edin? Where are you joining in from? Yeah, talking about depression. So we are talking about depression. It's one of the very common mental health disorders. And it's important to talk about it as a number of people, actually, millions of people suffer from depression all over the world. It's irrespective of race, ethnicity, gender, social status, or even age-wise. So it's important to talk about this mental health disorder. Just let me know if you can hear me. Let me know where you are joining in from as we get on this very important discussion. Promises to be interesting. So we are live. We are live. We are live. So, depression is a mental health disorder and it's very common, as I said earlier. It actually involves depressed mood or low mood. It could be um, a manifestation of many things. I'll be looking at the different causes of depression. It could lead to loss of interest in the things that an individual was or usually is interested in, and it can actually lead to some other medical mental health conditions. It can worsen those conditions. So it can exist with anxiety, for example, and it can exist on its own. And if you have ever been depressed, then you will know what this means. It's a major cause of lack of productivity or low productivity in individuals in life, whether in school, in career, in any endeavor. According to the World Health Organization, health is actually a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So that mental component of health is very vital, and it's something that is common um, all over the world, and it's usually a cause of presentation at clinics and even at the emergencies. As depression may even get to the extreme of an individual thinking of a suicide or attempting to commit suicide. All right, and it's different from regular mood changes. Sometimes you have some mood changes about um, your experiences in life. This is actually different. There are different factors that can identify an individual as suffering from depression. So it can affect different aspects of life, not just school or career. It can affect relationships negatively. It can also affect an individual's connection in terms of spiritual connection, relationship with God. And of course, all these are connected, they are interrelated. It can happen to anyone, irrespective of age, as I mentioned, irrespective of race, irrespective of status, irrespective of gender. And we'll be looking at the different factors that can cause depression. And before we go to the different causes, let's look at some statistics here. There's an estimation that about 3.8% of the population experience depression. That's according to the World Health Organization, including 5% of adults, where we have more men being affected than more women actually being affected than men. And it's common in even in the older adults greater than 60 years. Approximately 280 million people in the world actually have depression. 280 million people. That is a staggering statistic. Statistic there. Depression is about 50% more common among women than among men. And we're looking at some of the reasons. Then worldwide, more than 10% of women, pregnant women, and women who have just given birth experience depression. So there's something we call postpartum depression. That's depression that occurs after delivery. That's common, uh, commonly found in some women. Now, more than 700,000 people die due to suicide every year. So, suicide can be a result of depression. So, it can be a complication of depression. It is said to be the fourth leading cause of death in 15 to 29-year-olds. Is this not staggering? About the fourth leading cause of death in the age group 15 to 29 years. And we'll be looking at some of the symptoms. Let's look at some more statistics. Some more statistics on depression. Okay. It is said that about 20.78% of adults in the United States, or 50 million Americans, live with mental health illness. That's on a general note. So mental health illnesses are very common, quite common, even in the United States. According to data, as mentioned earlier, it affects all age groups. So, have you ever experienced depression? Kindly let us know in the chat box or in the poll, because the poll is anonymous. So you can share your experience with us if you do not mind. Still on some statistics here. About 50 million Americans said to suffer from depression with a mental health illness. About 21 million adults actually experience a major depressive episode. That's serious. About 21 million adults in the United States actually experience a major depressive episode. Now, adult women are more likely to have a major depressive episode, and the prevalence among women is 10.5% compared to 6.2% in men, according to National Institute of Mental Health. It's also been found out that people who reported having two or more races had the highest prevalence of major depressive episodes. That's about 15.9%. And more than 1 in 10 young people in the United States are living with depression. And that actually affects their schoolwork and home life generally. More than 1 in 10 young people actually suffer from depression. And a great percentage of that age group, 12 to 17, have actually had a major depressive episode in the past year. Now, young adults aged 18 to 25 are the highest risk of a major depressive episode. 18 to 25 years, according to National Institute of Mental Health. Depression is more common in people who give birth. I mentioned postpartum depression the other time. It said that 10% of pregnant people and people who have just given birth experience depression, according to the World Health Organization. And then the severity of symptoms range from 2.8% of United States adults who experience severe depression symptoms, while 4.2% experience moderate symptoms and 11.5% experience mild symptoms. So usually the greatest percentage experience mild symptoms, according to the Center for Disease Control and Prevention 2019. Mental health conditions are said to actually be worsened by COVID-19 pandemic, and the percentage of adults with a diagnosed anxiety. Of course, COVID brought a lot of tension, and it was definitely a cause of mental health disorders or issues during that period. And then post pandemic, from August 2020 to February 2021, the percentage of adults with a diagnosed anxiety or diagnosed depressive disorder went from 36.4% to about 41%, with the largest increases between the age of 18 and 29. Okay, welcome back. Still talking about depression. It's important to talk about this as part of way of healing for some people. You need to know what you are dealing with and then finding ways to deal with depression. The fact is that there is always a way out. There's always a way out. Good morning, Dino Catalin. Thank you for joining in. You're welcome. It's a very good morning from this side also. It's about few minutes before 4 a.m. What time is it in your location, Dino? Are you in Spain? Where are you joining in from? Thank you for connecting with me on this live. You're welcome. Thank you for joining in. And thank you for casting your votes. Oh, Romania. Almost 5 a.m. in Romania. You can't sleep. Whoa. Okay. Kindly note that as part of our discussion, the issue of sleep disturbance is a symptom, could be a symptom, one of the symptoms of depression. Okay. So, but for you, why can't you sleep, Dino? Is it Dino Catalin? Why can't you sleep? What exactly is happening? It's 5 a.m. already, so it's expected that you are in a new day. How many hours of sleep have you had over the night? Okay, are you worried about something? Or we are talking about depression on this live, and I was giving some statistics, or still on those statistics. All right, so the statistics on the exacerbation of depression, it was noticed that COVID-19, actually, the pandemic increased the rates of anxiety and depression all over the world, and especially in the United States. It was observed that the statistics revealed that there was a shift from about 36.4% to 41.5% of anxiety. Of course, COVID 19 was a big issue. It really was a cause of anxiety and of course, depression. People, the whole world actually was like put into confusion at a point. It was as if we really didn't know what this was about and what it was going to end in. But just like a number of people were affected. Some uh, passed on, while others suffered from some debilitating medical conditions. Some who had chronic medical conditions like diabetes, hypertension, bronchial asthma, the elderly, pregnant women, a number of people, even health workers, were really at risk, and some actually lost their lives. There are some who actually suffered from long-term effects of this virus, COVID-19. Okay, so Dino, you said you were diagnosed with depression and insomnia, but recently you stopped taking sleeping pills. And for the past year, you said you've been sleeping about once every 2 days. That's serious. All right. I believe you are actually um, in touch with your physician, which is very important. Your follow-up is important. If you are diagnosed of depression, so that means you you can actually mention some of the symptoms you had then. Of course, lack of sleep is one of the common symptoms of depression. As I mentioned earlier, loss of interest in things that you would normally be interested in, or an individual is interested in, and low energy, low mood. These are some symptoms of depression. So lack of appetite could even lead to weight loss, unintentional weight loss. So being diagnosed of depression and insomnia, insomnia is actually the inability to achieve or even sustain sleep. And for every adult, you should be able to sleep 6 to 8 hours overnight. And if you miss these 6 hours, then you should be able to make up with naps in the day so that you be more uh, re-energized and you will be refreshed and you have a renewal of your strength to do your daily routine. So it's important to ensure sleep. So, Dino, uh, say you stop taking your sleeping pills. Did your doctor say you should stop taking your sleeping pills, or you decided to? Okay, so talking about medication use, you should always ask for a review of your medications if you have any challenge with your symptoms or with the medications. So that's very important. So you may need to see your doctor for proper assessment and review of your medications. Okay, so sometimes some of the medications may require a change, and sleeping pills could be addictive, so you need to be careful. And I'm sure your doctor um, is there to help you, to guide you on getting the best from medications and other aspects of management of depression and insomnia. Okay, so thank you for sharing your experience with us, Dino. But sleeping about once every 2 days, okay, means that you should be seeing your doctor um, for a review. Is there an improvement? Is it that you have an improvement for your sleeping pattern, or it's worse than before? So you say, but you feel good. I'm happy to know that you feel good. You know? Okay. You say I made the decision. Dino says I made the decision on my own because I couldn't stand constantly going to the doctor anymore. Yes, that's one of the challenges of having a chronic medical condition. The need to visit the hospital or consult with your doctor frequently, but it's still important to always check with your doctor so that you are receiving that professional guide and then a more accurate management of your condition. So you couldn't stand going to the doctor anymore. Lately, you started meditating, wow, and discovering your faith, and it makes you feel so much better. I'm happy to hear this. Okay, so religion plays a big role. I'm a Christian, and I understand the place of uh, being connected to God, well connected to God, and how that helps. Okay, even though the World Health Organization has defined health as a state of complete physical, mental, and social well-being, there is the spiritual factor component to health, and we must recognize our connectedness to God and ensure that we actually um, building our relationship and growing our relationship with the divine, the one who has created us. Okay, so as a Christian, I understand the role of faith, of your faith in ensuring in life generally and having a good health. We cannot deny that fact. Okay, so thank you for sharing your experience with us. Um, faith plays a big role. Your faith plays a big role. Excuse me, plays a big role in your health. Okay. So I'm happy to know that you feel much better. And meditation is a key aspect. Meditating on the Word of God, you know, the issue of depression also actually flows from not just physical experiences. There could be mental experiences, really, the mental health issue. So the aspect of your thinking pattern, the way you feel, are, are areas to be considered when talking about depression. Thank you, Dino. Is it Dino? Dino Catalin for sharing your experience with us. And I believe with this interaction, we can, we're learning from one another, and then we can get to enjoy better health. If you are yet to subscribe to my channel, kindly subscribe now so that you can get notifications when I upload videos. Interestingly, I have a number of um, health topics that I've talked about on the channel, whether in videos, shorts, live sessions. I'm sure you find these videos interesting and helpful. So remember to subscribe, remember to click on the notification bell, and you will do well to share with others. And remember, you can actually double tap on your screen so that the YouTube algorithm can see this um, live and send it to more people that may benefit from this session. Thank you for your attention. Now, still on statistics, about 280 million people worldwide live with depression, according to the World Health Organization. And depression affects all age groups. All age groups. And 1.9 million children aged 3 to 17 have a diagnosis of depression. So, depression can affect anyone at any age, and it should, for children, the symptoms, I mean, you should be able to identify, as an adult, you should be able to identify the symptoms in your child or a child around you and seek proper medical care. Now, a recent study by Gallup showed that 29% of Americans have been diagnosed with depression during their lifetime. 29%. Wow. And with women and young adults more likely to be diagnosed with it. That's according to Adam Scowley, a medical director and head of psychiatry with Caron Treatment Centers in Pennsylvania. Now, let's talk about the gender disparity. In terms of the gender disparity among depression diagnosed, there are both social and biological factors behind the higher prevalence of depression among women. So it's not just a biological factor, there is the social factor that makes the female to have more, to be at risk, more at risk of developing depression. So socially, women might be doing more emotional labor and caregiving, and that happens a lot. I did some talks on self-care, loving yourself, self-love, and this is a very important thing or discussion for each and everyone, male or female. You need to understand the place of caring for yourself, loving yourself, and this will even help you to be able to help others to be able to care, show better care for others, and show love better, because you can't really give what you don't have. So if you have love for yourself and within yourself, of course you love God, and you must necessarily love your neighbor. And the Bible says, love your neighbor as yourself. So you must first love yourself so that you can really love or show love to others. Now that means for the women or the women, that means the weight of many aspects of family, child care, elderly care, doing household chores, family schedule mostly fall on women's shoulders. And this creates a situation where they are losing care for themselves physically or mentally. And this lack of sleep, poor sleep, uh, that kind of lifestyle where they are deprived of hours of sleep, and in fact even nutrition, and then they are not able to exercise, do personal things, set boundaries, don't know how to say no. So this increases their risk of depression, um, talking about that social setting. Then there could be hormonal fluctuations. This can increase a woman's biological propensity toward depression, because there are shifts in hormones, especially during reproductive life. Even with their menstrual cycle changes, with the hormones also reflect in changing in mood. So sudden shift in hormones may also be a factor, including uh, pregnancy. If you have ever been pregnant, if you're a woman, you will be able to share this experience about how you observed some changes in your personality, in your mood, even uh, during pregnancy, different from when you were not pregnant. Postpartum, after delivery, and perimenopause, this can affect sleep and mood significantly, and also lead to depression. Now, depression along with anxiety has also spiked among young adults. So they are like twins, depression and anxiety. They could exist individually, separately, but they could also uh, be a comorbid existence in an individual. Also said that this spiked during the pandemic, COVID 19, depression with anxiety. So, according to the World Health Organization, social isolation and difficulties working, visiting family, and feeling like part of the community are some of the reasons for the increase in depression anxiety post COVID. So, there were gaps. There was that reduction in relationship, in connectivity, apart from being on social media. A number of people could not actually connect physically as they used to, and even post COVID, there was a reduction in that connectivity. So people do more of social media connections. So there was isolation, then difficulties with work. Some people actually lost their jobs during COVID and post COVID. A number of companies were folded up, and this affected individuals and even families. So cases of depression, anxiety actually increase. As they increase, the struggle to find quality mental health care also worsened. So while there's an increase in people seeking help for their anxiety, we discussed, we had a live session some weeks ago where I invited a mental health expert who came to speak with us on anxiety. So you can watch that video at the end of this live session. I'm sure you find it informative. So there's a significant lack of access to mental health care. So there's a need for advocacy as a family physician, as a medical doctor, um, um, passionate, advocating for support in this area, for more people to receive help, assistance, for people to actually come out to get appropriate evaluation. People need to be sure of the diagnosis and then the treatment. Now, untreated anxiety can actually lead to depression. So, if you are just being anxious and you think um, you are not able to handle it anymore, you is disturbing your work pattern, your life pattern, then you may be at risk of developing depression. So there's a rise in depression these days because of the state of anxiety that's increasing all over the world. So talking about depression in America, by the way, I have more people in the United States of America watching my videos and subscribing. So it's interesting to have these statistics for the United States. Okay, in the United States, the average depression anxiety rate in the US is 32.3%, according to the Kaiser Family Foundation. Average depression and anxiety rate is 32.3%. That's quite high. And then in the United States, also depression is often accompanied by substance use, with a 50% increase in drug overdose. The overdose deaths between 2019 and 2021, and then mostly due to fentanyl. So substance abuse was also has been noticed to increase with the depression. So a number of people trying to find ways or solution to handling their mental health issue, especially depression. So we'll be looking at the management, how to deal with depression. Hawaii has the lowest rate of anxiety or depressive disorder at 23.9%. Louisiana has the highest prevalence of anxiety or depressive disorder. That's at 39%. Now, the state with the lowest suicide rate, as documented by 2021 data from the Center for Disease Control and Prevention, is New Jersey. Jersey at 7.1 deaths per suicide per 100,000 people. Now, the state with the highest suicide rate is Wyoming with 32.3 deaths by suicide per 100,000 people. Now, the highest suicide rates were among adults. That's what has been discovered, that the highest suicide rates were among adults, ages 85 or older, followed by 75 to 84 years old, and then closely by 25 to 34 years old. Now, across the United States, certain racial groups and ethnicities are at greater risk for depression. So, Latin Americans were the most likely to report current depression with a prevalence of 40.3%. Wow. So, followed by other racial categories, um, Native Americans, Asian Americans, and indigenous people, Black Americans, at a prevalence of 27.7%, and then white Americans at 25.3%. So, from a study by Dr. Scaoli, he points out that some of the states with the highest rates of depression and mental illness in the United States include Louisiana, West Virginia, and Kentucky. These are the same areas that are said to have been hit hardest by poverty, economic shifts, the pandemic, and the opioid epidemic, which are all tremendous stressors that could contribute to the prevalence of depression in these areas. Okay, so these are stressors, these are factors that could said to be responsible for the rates of depression in these areas. Now, this increases the risk of, also increases, okay. Now, he said that in these states, that's Louisiana, Virginia, and Kentucky, all of which include rural areas, there is a disparity in access to preventive health care, which increases the risk of cardiovascular disease and other chronic diseases. Now, this leads to increase in risk of developing depression. And lack of healthcare extends to mental health services. So the social factor is there: poverty, lack of social uh, facilities, lack of healthcare facilities, uh, reduction in access, reduced access also be a cause of depression. Now, the higher rates of depression among Latins and Black communities and indigenous communities as compared to white communities is also related to poverty and generational trauma among these communities. Hmm. Medical stigma and distrust of medical institutions because of medical bias and microaggressions also a factor in the lack of access to culturally sensitive mental health care. For example, Black women are only half as likely to seek mental health support as white women, according to John Hopkins Medicine. Okay, so these are studies that have been conducted to actually help to identify the um, different factors influencing these statistics. Okay, so let me know if you can still hear me in the chat box. Let me know if you can hear me. Remember, you can double tap on your screen to like this live session. Okay, and thank you for voting. Thank you for your votes. So we'll be looking at some other statistics on depression. Hello, Cataline. Kindly confirm that you can hear me. Welcome back. Please confirm that you can still hear me. Am I audible? Welcome back. Please confirm that I'm audible. Can you hear me? Let me know if you can hear me. I want to be sure that I'm still audible. Can you hear me? I need to know if you can hear me so we can continue our discussion. Okay, Dino says, my opinion is that depression often arises not only as a chemical imbalance in the brain, but also as a consequence of external factors in the world we live in, especially under the capitalist system. You're right. You're right. It's not just a chemical imbalance thing. There's the aspect of external factors, the world we live in. Can you hear me? Am I audible? So Dino is saying that it's not just about the changes in hormones that occur in the body, but also the external factors that influence an individual's mental health. Yes, the social environment, economy, and relationships. Now let's look at some other statistics, health statistics, and depression. Depression is associated with a variety of chronic health conditions. For example, 51% of people with Parkinson's disease are also affected by depression. 42% of people with cancer and 27% of people with diabetes and 17% of people with cardiovascular conditions experience depression. So these medical conditions also put people, individuals that are affected at risk of depression. Okay, so that's why it's important to manage any form of medical condition well enough so as to prevent the development of another medical condition that could worsen an individual's condition. All right, so the first medical profession to which some Americans may report depression, most people actually present to their primary care physician, but statistically, 50% of depression diagnoses are said to be missed in a primary care setting. Wow, that's serious. So that means even for professionals, if not well educated, if not well informed, if not up to date, if there's no proper history taking or evaluation of an individual or a patient, then it is possible to miss the diagnosis of depression. That's serious. Okay, so one significant aspect is also receiving appropriate treatment for depression, which is said to be a challenge for 28.2% of adults in America, while 42% of adults report that they did not receive adequate care because they could not even afford it. So prevention is actually better, it's cheaper than cure, and but for anyone who has been diagnosed of depression or who is being managed, there is a need for support and increasing support. Governments need to do more. Governments of different nations, non-governmental or agencies also need to get involved. Communities, religious organizations, families, and friends need to come out to support and help individuals are living with depression. Now, on statistics, we'll just look at this remaining aspect before we go to the symptoms of depression. One significant barrier to comprehensive mental health care is the lack of health insurance. And in nations where this is not well established, there is no universal health coverage. So this is a challenge for people to access healthcare services. So of adults who have a mental illness, 10% do not have insurance. Hmm. Those numbers are also almost twice as high for Hispanic adults, and 19% reporting they are uninsured. So there are likely more people with undiagnosed depression and other mental health conditions. But if they are unable to visit a medical practitioner and report their symptoms and get a diagnosis, they will also not be able to access treatment. So accessing the medical services is a key aspect of receiving care. So we'll be looking at treatment of depression, how you can prevent depression also. A depressive episode, actually, if a person experiences a depressive episode, the experiences that the person has include feeling sad, the person may be irritable and feeling empty. They may feel a loss of pleasure or interest in activities, as mentioned earlier, interest in things that they would love to do. And then there could be low energy. So other symptoms are also present, which may include poor concentration, could be a symptom of depression. You may find yourself losing concentration in school or at work, even at home. When people are communicating with you, you notice that, or they notice that you are not paying so much attention. It may mean uh, depression. Poor concentration is a symptom. So feelings of excessive guilt or low self-worth, also a symptom of depression. Hopelessness about the future, thoughts about dying or even suicide, attempts at suicide, disrupted sleep, like Dino was sharing his experience with us, changes in appetite or weight, uh, unintended weight loss, feeling very tired or low in energy. These are symptoms of depression. And this can cause difficulties in all aspects of life, including the work environment, school environment, home environment, even the community. So it can affect people's career and limit their progress as they may not be functional at their duty posts. Now, there are different patterns. I'll quickly mention this before continuing on other aspects. There are different patterns of depressive episodes, and this include a single episode depressive disorder. That is the person's first and only episode of having a depressive disorder. There could be a recurrent depressive disorder, meaning that the person has a history of at least two depressive episodes. That's a recurrent depressive disorder. There could be a bipolar disorder. This means that there are depressive episodes which alternate with periods of manic symptoms, which include euphoria, irritability, increased activity or energy. So sometimes the individual is low on energy, other times you see the individual being high in mood and in activity. So other symptoms such as increased talkativeness, raising thoughts, increased self-esteem, decreased need for sleep, distractibility, and impulse reckless behavior. This may be found in bipolar disorder. Now, talking about risk factors for depression, there are different factors, and it's not limited to biology, as mentioned earlier, which commonly affects the female, but there are also social factors. So it's an interaction between these factors, the social factor, psychological factors, and then the biological factors. So people who have gone through adverse life events like loss of a job, bereavement, certain trauma, some people have even suffered from a rape and events like that could be a loss of a dear one. So these are these are events that put an individual at risk of becoming depressed. Oh, welcome back. You know, say you lost your connection. I hope you can hear me now. I tried to get your feedback. I hope my audio is clear. I hope you can still hear and see me well on this live. Welcome everyone joining in. If you are, thank you for the feedback. Are you subscribed to my channel? You can subscribe to my channel right now if you are yet to subscribe. I said so that you can get updates when I upload videos or even come up live as I'm doing right now. We're talking about depression for those that are just joining in. Um, Kindly cast your votes in the poll and you can share your experience with us. If have you ever been depressed? Or do you know someone who has been depressed? Or do you even know someone who is currently being managed for depression? So we are looking at dealing with depression, finding solutions. Okay, so we have looked at statistics. We have gone into that, so you can watch the replay after, and then we have talked about the symptoms. Now we are looking at the risk factors. Okay, okay. Thank you, Dino. Thank you. Thank you for your feedback. Okay, so you are subscribed. Oh, you're subscribed to my channel. Okay, I'm so sorry. Yeah, the name is very familiar, but maybe it's been a while. We got to see on the live. So thank you for subscribing. Remember to double tap on your screen. When you double tap on your mobile, um, then you get to give me a like for this live session. Thank you. Or you click on the three dots that will show you the like button, the icon, so you can click on that also. Thank you. A number of people actually need to be hearing this, and I'm sure it will help. It's going to help more people. So, uh, a a significant life event, negative one, can cause an individual to become depressed. So, depression can in turn can lead to more stress and dysfunction and in fact worsen an individual's life, the situation, and then the depression itself. So it's really a very sensitive condition that could get worse on its own and even affect other aspects of an individual's life. So individual may not even care for people that have chronic medical conditions. Once they are depressed, they lose interest. They are not concerned about even their own body, their care, the care they show to even themselves is not there anymore, and this can affect their overall health. So depression is closely related to and affected by physical health, and many of the factors that influence depression, such as physical inactivity, yes, also affects um, uh, determine if an individual can get depressed. Now, your mood will change when you are physically active, when you have things that you are actively engaging in, when you are having goals that you want to achieve. You are not likely to have time to be withdrawn, to be lost in your thoughts, because you are trying to meet targets, you are trying to achieve goals. So it's an advantage to be active. Okay, so because you can see that symptoms of so part of the symptoms of depression includes loss of interest, low energy, loss of interest in things that you normally would love to do, okay, and low energy. So, if a person is physically active and exercising is um, an aspect, a type of physical activity that is uh, something that you intentionally get involved in, that you are disciplined about, and you get to see results. So many of the factors that influence depression, such as physical inactivity or even harmful use of alcohol, they are also risk factors for developing other medical conditions like cardiovascular diseases, risk of diabetes, risk of liver cancer. Okay, so respiratory diseases also. So in turn, people with these diseases may also find themselves experiencing depression now due to difficulties associated with managing these conditions, as I mentioned earlier. So these people require a lot of support. If you know someone that is having a chronic medical condition like diabetes, hypertension, bronchial asthma, sickle cell anemia, arthritis. In fact, especially the older adults, the elderly, they tend to uh, have challenges with coping with this condition. So they will need a lot of support. Prevention programs have been shown to reduce depression, and effective community approaches to prevent depression include school-based programs, which enhance positive coping in children and adolescents. So interacting at that level helps a lot. Interventions for parents of children with behavioral problems may also reduce parental depressive symptoms and improve outcomes for their children. Exercise programs for older persons also can also be guided and effective in preventing depression. All right, so we're still talking about preventing depression, how to prevent. Now, you need to, number one, develop healthy coping skills. I mentioned earlier, some people are not able to cope with certain situations of life, medical conditions, stress factors, could be school related, could be work related, it could be relationship related. So you must learn to manage stress and setbacks without resorting to negative habits. Someone could get jilted, disappointed, lost a job, and go into alcohol, drinking alcohol, or substance abuse generally. While another person can choose to deal with the situation by looking for another job or connecting with God to get another relationship. And this will go a long way to avoid getting depressed. So you must develop your coping skills. For some people, it is communication, communicating with other people can help to handle and prevent developing depression. So you can also prevent depression by building a strong support system, just like I mentioned earlier. Your family and friends will play a big role, and if you know someone that is suffering from depression, you should be able to help the individual, be able to support, because that's a major aspect of their care. Okay, but you can prevent depression by having solid relationships, positive relationships, and building on such relationships. Family, friends, colleagues, support groups. This can act as a protective barrier against depression. In fact, your religious support is very important. So you must have a network, family that helps you to enjoy that social aspect of your life. Next is maintaining a healthy lifestyle. Now, exercising, ensuring good sleep. Dinner the other time was talking about having challenges with sleep. Okay, so uh, it could be a symptom. Sleep disturbance, it could be a symptom of depression and some other medical conditions. Okay, so exercise is good, sleeping well, eating nutritious food regularly to maintain your physical and mental health. These are also very important. So practice self-compassion. That's the next point. You have to be kind to yourself. You should avoid self-criticism, which can lead to negative thought patterns. I mentioned earlier, this is a mental condition, mental health condition, and it's related to how you think and feel about yourself, about what people think or feel about you. Okay, so but you must be kind to yourself. You must love yourself. You must care for yourself. So self-criticism should be avoided, and then thought patterns that can trigger depression should be avoided. Then you should stay socially engaged. Even when you feel like withdrawing, you must intentionally engage with others. You should be able to relate appropriately with others. That's a way of dealing with or preventing depression. When you are excited, you are lively, you are loving, and you enjoy relating with others. So social connection can help to guard against loneliness and isolation. It's not a time to be isolated. People who have suffered from suicide uh, sometimes move into isolation, first of all, separating themselves, and then giving room for the overwhelming thoughts that could now lead them to committing suicide. Let me know if you are following. Can you hear me? Hope I'm still audible. Thank you for joining in. Remember, you can double tap on your screen to like this live session, and then you can also subscribe if you are yet to subscribe to my channel. This health, wellness, and lifestyle. We do a lot of talks on health, how to prevent, and then how to manage, how to maintain good health. That's our focus on this channel. Now, another point is that you should set realistic goals. You should avoid the stress of perfectionism. You are trying to ensure that everything is very perfect. No, there will definitely be challenges, but you must learn to know things that you can achieve per time. Goal setting is very important. A goal must be smart, must be specific, and you must be able to. It's something that you must be able to measure. It must be achievable. It must be realistic. It must be time bound. So these are ways to help to achieve your goals. Now, the next point is that you should limit stress. You should learn to say no and manage work life. There's something called work life balance to reduce uh, overwhelm and then stress. You should be able to balance your work and life. You need to be able to learn when to rest, when to say no. Okay. Then you need to seek therapy as early as possible. If you begin to find yourself having some of the symptoms that have been mentioned, you should seek early therapy, like you're consulting with a doctor, the doctor making a diagnosis after proper history and then examination. Uh, Management will include cognitive behavioral therapy, where you have sessions where you are engaged in counseling sessions about habits and behaviors that you can actually change to achieve the kind of health that you desire. So other therapies can also teach you skills for preventing uh, future depression. Now let's go to management of depression. Just like I mentioned earlier, the cognitive behavioral therapy, where you get to engage with a professional, um, psychologist, psychiatrist, will help you to be able to handle this. So seeking professional help is very important. Mental health professionals are available, can help provide therapy and possibly medication if you need to have medications to treat depression. Just like Dino mentioned earlier, meditation is a key aspect. You should learn to practice mindfulness and meditation. These exercises help to reduce stress and negative thoughts. As a Christian now, I believe in the Word of God, the Bible, and the Word of God, meditating upon the Word of God goes a long way. It gives life, it gives health, like health. flesh to your bones. That's what the Bible says. So you get healing, you get uh, health from meditating on the right things. Meditating on the Word of God will help you. So it will help to reduce stress and negative thoughts. So your mind cannot be empty if you don't engage in positive thoughts, in spiritual thoughts, thoughts of God. In fact, the Word of God says, "I know the thoughts that I'm thinking towards you, thoughts of good and not of evil, to give you an expected end." So that's what God is saying. So you also must engage in thoughts, or with thoughts that are good, that are helpful for living a more productive life. Next, stay active. Exercise increases endorphins, the body's natural mood elevators, and can help reduce depression. I mentioned that earlier. You should also establish a routine. Having a structured day can provide stability and reduce feelings of unpredictability or chaos. Now, you're going to avoid a lot of chaos or trouble in your day when you are organized, when you have a plan, when you have a structure that you are following. But if you don't have such a plan, you don't have such a structure, could affect, disturb you a bit, especially when you are not able to even meet up with some targets or goals. So it's important to establish a routine. This helps a lot. Now you should learn to connect with loved ones. Social support is crucial. As mentioned earlier, if you're suffering from depression, you should be able to connect well with others. You should receive help and assistance. You should receive support, moral, emotional, even financial, for people that may even need it for uh, rehabilitation, and then for even for their medications. Connecting with friends and family or a support group can help to make you feel less isolated. Remember, we mentioned that isolating self is not what should be in this case. You should learn to connect with others to prevent depression. Next, you should focus on small achievements. Like I mentioned, you set achievable goals. Your goals uh, should be specific, should be measurable, should be achievable, should be realistic, and should be time bound. That will help you a great deal. We'll be running up with this discussion soon. So let's look at the remaining ways by which you can manage depression. You should learn to celebrate small victories. You know, you don't need to have a sense of loss, a sense of no, you should not have low self-esteem. And the way to deal with that is to celebrate yourself, celebrate your achievements, no matter how small the level of achievement is, and this will help you to avoid depression. You should. I want to add that you should avoid feeling bad if you are not able to meet up with your goals, or even feel that others are doing better than you. You should avoid that thought that could be overwhelming and get you depressed. So you should next prioritize sleep. Good sleep hygiene helps in emotional regulation. So you should aim for a consistent sleep schedule. You should plan it. Have a time you go to bed, and then a time to wake. So you have a regular pattern. So that doesn't disturb your health or life in any way. Next, avoid drug abuse, limit alcohol. Substance use can worsen depression and interfere with treatment. That's the fact. Next, engage in creative outlets. What hobbies do you have? Writing, singing, painting, and then this can help to give you a sense of purpose and expression. Remember, inactivity can worsen depression, and you should engage in activities that are meaningful and are productive. So nutrition is a very important aspect. Balanced diet with nutrient-rich foods can support the brain function. Eating balanced diet, fruits, vegetables, um, nuts, apples, um, healthy proteins, and the healthy fats are important for you. They help in brain function and overall well-being. So I'll quickly answer some common questions about depression. If you have any question, you can kindly drop now as we move towards the end of this live session. Thank you everyone for joining in. Dino, thank you for joining in, and every other person. So, what are the signs of depression as we round up? Signs of depression include sadness, which may be persistent, loss of interest in activities, feelings of hopelessness, difficulty sleeping or sleeping, excessive sleeping. In fact, that could also be a symptom, a sign of depression. Changes in appetite, fatigue, and difficulty concentrating. These are important symptoms. Next, how long does depression last? Depression can last for different lengths of time depending on the person and the severity of the condition. It could be mild, it could be moderate, it could be severe. It can be temporary, lasting for weeks or months, but without treatment, it can last much longer. So, depression could be chronic. Can depression be cured? Depression can be managed and treated effectively with therapy, medication use, which is an important aspect in the management that we didn't talk about the other time. There's certain antidepressants, certain medications that individual should receive prescription from their doctor to manage this condition. So lifestyle changes are also helpful. Some people experience full recovery while others may manage symptoms with long-term treatment. So that's where follow-up comes in. What causes depression? Next, depression can be caused by a combination of genetic, biological, environmental, and psychological factors. It often arises after a major life event, chronic stress, or trauma. Now, is depression the same as feeling sad? Some people ask. Depression is more than just feeling sad. Mm. It is a persistent condition that affects daily life, including thoughts, emotions, and physical health. It's not just a temporary mood change. That's depression. Next, how can I help someone with depression? This is a very important one. How can you help someone with depression? You need to encourage them to seek professional help. You need to do that. Encourage somebody to get professional help. See your physician and then offer emotional support. And then people like other professionals like a clinical psychologist, a counselor, a psychiatrist, lifestyle doctor will be helpful in handling this condition. And avoid being critical or offering simple solutions, as depression is a complex condition and requires proper treatment. It's not something that just needs to be treated at all. Let me know in the chat. Okay, so it says it's still not working. Even now, still not working. What about now? Serious. So there was a connection problem at a point. So let me know at what point you stopped hearing. I've talked about measures to prevent depression. We talked about management of depression. Let me know what you heard. At what point did you stop hearing? Do you know? At what point? So at what point did you stop hearing? I want to know if you want me to go over it again. So I'll quickly go over how to prevent depression. One, you need to develop healthy coping skills. Number two is to build a strong support system, family, friends, colleagues who can support you. Three, maintain a healthy lifestyle. Okay. Yes, thank you, Dino. I'm going over the points again. Say you forgot, suppose we're on emotional support, okay? Yeah, talking about support, very important. Maintain healthy lifestyle through exercise, sleep well, eating nutritious meals, maintaining physical and mental health through these activities. Seek therapy early. That is for cognitive behavioral therapy, other forms of therapy that you may benefit from if you are suffering from depression. Then practice self-compassion. You must be kind to yourself. You must avoid self-criticism, negative thought patterns, which are not helpful. Now, stay socially connected or engaged. That's the next point. This will help you to avoid loneliness and isolation. Next is set realistic goals. Your goals should be smart. Smart. That is, they are specific, they are measurable, achievable, they are realistic, and they are time bound. Finally, you should limit stress. Learn to say no, manage work and life balance to reduce stress. And then finally, on management of depression, these are tips. You should seek professional help early enough. Next, practice mindfulness and meditation. Um, you can meditate on the Word of God as a Christian. Stay active. You should exercise regularly. This helps to increase your mood and can help reduce depression. You should establish a routine. Having a structured day will also help you a great deal. Can help to stabilize you and reduce feelings of unpredictability or chaos. Connect with loved ones. That's the next point. Your social support is crucial. And regularly talking to friends, family, support group can help you to feel less isolated. Then focus on small achievements. Set achievable goals to avoid feeling overwhelmed, and you should learn to celebrate small victories. Next, you should prioritize sleep. Good sleep hygiene helps in emotional regulation, so you should aim for a consistent sleep schedule. Next, limit alcohol and drug use. Substance use can worsen depression and interfere with treatment. Next, engage in creative outlets. Hobbies like writing, painting, or playing music can provide a sense of purpose and expression. And finally, eating a balanced diet with nutrient rich foods can support your brain function and overall well being. I'm sure somebody has found this live session helpful. Thank you, Dino, for making it engaging. Thank you for sharing your experience with us. And everyone who joined in, thank you for joining in live. Thank you for casting your vote. And you can go over this video once it's available on the channel, talking about dealing with depression, finding solutions. So uh, if you also need to kindly share with others, if you know someone that is suffering from this mental health condition, then they will benefit from it. Remember, you can always find a way out. There is always a way out. Thank you for watching. Remember to subscribe if you are yet subscribed to my channel. Remember to click on the notification bell so that you can receive regular updates when I upload videos or come on live. I will see you in the next video or live session. Thank you for joining in. Remember, I have a few videos up, recent videos uploaded. You can watch them. Something about your sexual health, and then another on the lies that people have believed about hypertension. I'm sure you find these videos very interesting. Thank you for your comments. Thank you for your questions. Thank you for your feedbacks always. Bye for now. Oh, okay. Dino, thank you. Thank you too, Doc. See you next time. Okay. Thank you. Thank you. You're welcome, Dino. Bye.